Hi, welcome to another episode of Chill with Bill. I'm Bill Wechter, the CEO at the Baptist Children's Hospital at North Central, and today I have with me Dr. Thomas Gowan. Dr. Gowan, tell me about your training to become an emergency medicine physician for pediatrics.
Well, pediatric emergency medicine has been around for a little while. It was the newest specialty in pediatrics, and now it's pediatric hospital medicine.
Dr. Gowan, what are some of the treatments that are different for children than adults in a hospital?
Well, children have a whole host of their own specialists. Dr. Tim McAvoy, ENT, you have pulmonology, you have neurosurgeons all trained for pediatrics, you have pediatric surgeons. So all the specialists, and we recognize them for their specialties in pediatrics, but you also have nurses that are especially well trained and respiratory therapists that know how to deal with a young infant, as well as a 16-year-old with asthmatic problems. So that's a widespread age groups that they have to be specialized. We also have a sedation. Some children may have special needs that have to have sedations for even the simplest procedures or imaging. And sedation is also something that we have to do with children that you don't have to do in adults.
Dr. Gowan, what do you like most about your job?
Well, one of the things I like is what I saw here in the zoo. Lots of children running, giggling, laughing. And I went into pediatrics because you can restore sick children for that most of the time. It's unlike adults where they have chronic diseases and you can't return them to full activity. Children heal well and they do well, and that's what drew me to pediatrics.
Well, Dr. Gowan, thank you for coming out with Chill with Bill and spending a little time with me here at the Hippo Habitat at San Antonio Zoo.
Well, I'm glad I could chill with you.